Hello there, Jane. So glad you can make it today.
Hi, morning, Rushmi.
So, for my audience today, I'd like you to all welcome the lovely Jane, who is a supervisor and a mentor teaching clinical hypnotherapy and specifically solution focused hypnotherapy. Jane originally gained her degree in biological sciences in 1980 at Aston University.
Time ago, long time ago.
You were very experienced. And yeah, you did a master in science, I believe, as well in Sheffield.
Yeah, yeah.
And then you went on to be a research assistant for the very uh, famous now Professor Horwell, who's a gastroenterologist. Can I say that right?
It's a mouthful, isn't it?
It is a little bit, isn't it? And you working with him in Withington Hospital in Manchester.
Yeah,
Um,
Withington Hospital, which is no more, sadly. But
Yes, yes, it's just a community hospital now, and I can say that because I was actually born at the original one.
oh, were you? Oh, wow. Okay.
When I learned that about you, I was like extremely excited. Yeah, and I believe that it's played such a huge part in the world of hypnotherapy since then, hasn't it? I'll let you explain why.
Yeah, well, yeah, I wasn't actually involved in the hypnotherapy at that time, but Professor Warwell collected a lot of data on from patients with irritable bowel syndrome, and he was perhaps one of the first people to use hypnotherapy in a clinical situation. So he used hypnotherapy to treat patients with IBS with great success. He was considered a bit of a maverick in those days, and it was all a bit woo woo.
Yeah.
But the data that he collected enabled NICE to recommend hypnotherapy as a treatment uh, for IBS, and it's probably I think alongside relaxation for cancer patients, it's the only thing that hypnotherapy is recommended as a treatment. So yeah, an amazing thing for us, really. So that piqued my interest in hypnotherapy way back then.
So groundbreaking. It's
Mm.
People don't realize how important that actually is. I think it was since 2008, is that right? It's been approved by NICE, something like that.
It sounds about right. I mean,
Yeah.
I was working there in the early to mid 80s, so
Mm,
that sounds about right. Yeah.
yeah. So you were also a clinical researcher in other fields as well, I believe. Can you tell us a little bit about that?
Yeah, I started working within the pharmaceutical industry as a clinical researcher. Um, uh, Clinical research associate. I was called a CRA, and
Mhm.
these are people that sort of visit sites just to make sure that everything's running fine with the studies, with clinical trials, with investigational medicinal products mainly, so new drugs um, being tested in patients. So yeah, it was a great job, and I learned an awful lot and travelled a lot. And it was good. So I always had in the back of my mind that I wanted to do hypnotherapy, wanted to train in hypnotherapy, but it was busy, life was busy with two kids as well.
Yeah.
But when they got to be a bit older, I thought, right now, let's do it. Let's train to be a hypnotherapist. I'd had hypnotherapy myself a couple of times over those years as
Oh,
well and
yeah.
benefited from it. So
You'd seen
I was,
firsthand the benefits of it.
yeah, yeah, yeah,
I think
yeah.
a lot of us who go into hypnotherapy have had this experience ourselves, haven't we? So that's why we can um, really be ambassadors and promote what we're doing because we know firsthand how it works. So
Absolutely. And a lot of people that come on our training courses are people who have benefited from the hypnotherapy as well and want to do that themselves.
yeah,
Yeah,
it's a wonderful way to help other people, really, isn't it? Safe
absolutely.
way without any medication involved.
Mm.
So yeah, when did you gain your diploma?
Oh, remind me, 2014?
2000, yeah, that's what I've got down for you.
I wrote
You've
it
done
down
so many
for you and
things.
forgot to remember it myself. It just seems a bit of a whirlwind, really, because I think you've got a few dates on there. Things moved pretty quickly once I decided that that was what I wanted to do. So,
Yes.
yeah, so I qualified in 2014, and I did the two jobs side by side for a while. I think a lot of people do that once they've trained. Just
Mm.
you want that steady, reliable income alongside setting up your own practice. So I did them side by side for a while, and also did the qualification to become a supervisor. So it's a level 5 diploma to become a supervisor.
What made you choose CPHT specifically? Because there are a few places
Right.
you
Yeah.
learn
Well,
hypnotherapy, aren't
well,
you?
I have to hold my hands up and admit it was just luck. I
Ah,
was looking for somewhere local, and CPHT had their satellite school in Manchester, so that was perfect. I went along and met the senior lecturer there, and we got on very well. And so yeah, I didn't shop around, and I wouldn't recommend that because I consider myself to be very lucky. But it did leap out from Google as as the first one, and that's because it's well thought of.
when did
And
they set up? Do you know, actually? I don't
oh
know.
gosh, it's I think they've just had their 25th birthday,
Oh, wow.
so quite a long time ago. But for a long time there was only the I think the Bristol and London schools,
Mm,
and then Manchester, and now we're all over the place now. I think there's something like 25 schools,
wow.
and we're in the Republic of Ireland. I think there's a satellite school abroad as well.
Gosh,
Uh,
really spreading
can't
then
can't
globally.
remember quite where. I think we're pretty busy in the UK, and of course with Zoom now, people can
Mm,
train anywhere in the world, and we can see clients anywhere in the world. So
true. And
yeah.
you can tell us a little bit about the training. I mean, I know that they use globally recognized techniques anyway, don't they? So,
Yeah, so David Newton, our founder, he was originally trained in Freud's technique of analysis by free association, or hypnoanalysis, and he was never really sure whether that was the way to go. But he did get interested in solution focused work, which came from the States, from Milwaukee in the 1970s. And he was particularly interested in the sort of positivity of that. So he amalgamated some of the elements of solution focused brief therapy and together with hypnosis, and found that it started to work really well. So he developed that for his own practice, and then he built up the school teaching people how to use his techniques. So we borrow a lot from solution focused brief therapy. So we are obviously solution focused. We do what it says on the tin. It's interesting that we do the same regardless of what our clients come to us with. Because we're solution focused. It's very positive. It's kind of client led in a way. We don't, excuse me, we don't tell our clients what to do. We believe that they have the answers themselves, and they have the strengths and resources to actually make the changes that they need to make in order to move forward to their preferred future. So I like to think of us as kind of sat navs in what we do. We sort of guide the client, and it's important that you know the client has to know where they want to be, like a sat nav. You don't say, I don't want to go to Birmingham. You say, I want to go to Sheffield, or whatever. You have to know what that end point is.
a lovely analogy. I hadn't thought of it like that. That's
Yeah,
great. And it's so wonderful for the modern technological era as well.
yeah,
A lot of
yeah.
people will identify with that, I'm sure.
Yeah. So our clients will come to us and say, I don't want to be anxious. I don't want to be angry. I don't want to be depressed. And we kind of turn that around. Well, what do you want to be? Where do you want to go? And yeah, they set their own manageable goals. And we kind of help them to identify that. We don't tell people what to do. We just help them to find their own answers, which I think is great. So empowering for the client. And I've just realised that isn't what you asked me, is it? You asked me about the training.
It's okay. That's all right. It's
This is what I do. Go off on a
You know
tangent.
what?
Anyway.
I do the same, Jane. You know, that's how we get on. Our conversations can branch, but then it's all interconnected, isn't it?
Yeah.
We can help clients globally, wherever they are,
Yeah,
because of
absolutely.
so it can
Yeah.
cater for all sorts of people who could be disabled, for instance. They can't drive, they can't travel. So
Mm,
as long as they can use the internet, they've got access. We can help so many people, can't we?
yeah, it makes it very inclusive.
Mm.
And Professor Warwell's team did do some research actually that showed that hypnotherapy for IBS over Skype was virtually as effective as over as face to face. So there is data to back up the fact that
That's
we
great.
can work with clients over Zoom.
I'd
But
love to
what
have
I
access to that actually later on. Maybe if we could like put a link,
yeah,
that would be
it's
amazing.
easy to find.
Yeah.
Um,
So you've
and
been teaching as well. You are a supervisor now. Yeah.
Yeah, so I'm senior lecturer at. I have been working in Manchester and Sheffield, but I've reduced that down to just Sheffield now. Um, yeah, you can get a bit too busy at things, can't you?
You do
But
a lot.
supervision is something I really enjoy. So I see supervisees one to one, but I also see them in groups, and that's good for everybody because we all learn from that. I learn from that. We have you'll know from our last group supervision, we have people who sort of develop expertise in certain areas, not often without even realizing that it's happening. So maybe working particularly with young people with autism, or working with children, working in a sports performance arena,
Mm.
and people develop their own niches, and
Yeah.
that's interesting for all of us to learn about. So I try and put a bit of education in my sessions, in my
They're
group
always
supervisions.
they're always interesting. You always learn something new, and
Yeah.
yeah, it's great to have that diversity as well, because then also if you are particularly, you know, interested in a certain area and you want to know a bit more, there's always somebody on hand that you can ask,
Hmm.
and you can
Yeah.
share this knowledge.
Yeah, and it's very mutually supportive. If somebody comes to group and says, "Oh, I'm feeling a bit deflated. I need to boost my business or something," people will be very willing to help and give some pointers to help in the right direction.
Yeah. So you're retired from clinical research now, aren't you? Is that
Yeah, I gave up about 2 years ago now. I sort of got to the point where no, I've got enough work with the
yeah.
hypnotherapy and with the teaching and with the supervision, and um, so I took retirement from early retirement from clinical research and decided to focus everything on the hypnotherapy side, and I've loved it. It's been fabulous. I'm glad I did it. I did like the clinical research, but yeah, it was time to make that jump.
Well, yeah, you've done so much. I mean, I was reading that you had done research in areas such as psychiatry, neurology,
Mm,
oncology,
mm.
and deep brain stimulation as
Oh, love the deep brain stimulation. No, that's a fascinating thing. It's sort of implanting electrodes into the brain to stimulate very particular tiny areas of the brain.
well.
Very successful for Parkinson's. You can see it just switches off the tremor if stimulation in the right areas.
Yeah.
And they use it for pain, switching off pain on certain nerves as well.
Hmm.
That's
Modulating it.
yeah, neuromodulation. Yeah,
Mm.
exactly. And I was involved in a study where they were using deep brain stimulation for depression. It was early days, and they were only doing it with people who had sort of untreatable,
Mm.
treatment resistant depression, if you like. So it was quite dramatic,
It's
but
fascinating, though. I think this subject is
yeah,
just opening up, really, isn't it? Now we
yeah,
include neuroscience as part of our training as well, don't we, in solution focused? And
yeah,
I
absolutely.
personally chose this course because it's so uh, broad-minded and open and evolving as well. That it's not just, all right, this is how we do it.
Mm.
No, it's
Mm.
open to further development as research comes along.
Yeah, and I think it's a very valuable part of what we do, that psychoeducation for our clients, explaining to them why they feel anxious, why
Mm.
they can't sleep, and why they feel depressed or angry, or why they have a phobia of buttons. I mean, who would think that buttons could be scary things? But of course, they can
Wow,
be.
gosh,
Um,
they got
and
a
that
special name. I bet it has.
it has, but I couldn't tell you what it is. That there is a name for it.
Yeah.
Um, but yeah, that psychoeducation is really important. And of course, David Newton came up with this simplified explanation of how the brain works
Mm.
for us to pass on to our clients. And what has happened in the meantime is that the research that has come out has just supported what he came up with in the first place. So, although it's very simple, in order for our clients at any level to understand it, it is correct. It's not wrong.
Mm.
Um, but it's very much simplified, and it can be mind-blowing for the client to actually
Mm.
realize that I'm not going mad. I've had that said to me many times, so I'm not going mad then. Because
And that
when you
makes a
have that,
huge difference, doesn't it? As soon as they come for their first
yeah,
appointment, the consultation, they're made aware of this. So I think that's groundbreaking for a lot of people, even at that stage. That like,
yeah,
oh yes, this it's such a relief, isn't it?
it
For
is, it is. And also the fact that when you're explaining to them what's kind of not working quite correctly, that we can change that, and we can get things back on track, working in a nice way,
and
um,
quickly as well,
and
exactly.
quickly.
So
Yeah,
efficient because some therapies go on for months and years, don't they?
yeah, yeah,
Which can be
yeah.
very
We
costly as well for people.
absolutely, yeah. We tend to talk about 8, 10, 12 sessions. It depends what it
Mm.
is.
Yeah.
Obviously, and the client, and how long they've had it, how severe it is, lots of different factors. So we have to be careful to set the client's expectations correctly, but that's sort of the general ballpark. I say to my clients, so not 3 and not 33.
No, because it depends, doesn't it, on the person. We're not all the same, ultimately.
Mm,
Everyone,
mm.
we tailor what we do, don't we? That's the beauty of hypnotherapy as well. So I'm just going to ask a few questions just generally for people who just don't really know the basics. Let me
Okay.
what is hypnosis even, in a nutshell? That's such a broad subject.
Okay, well, hypnosis is well, we kind of talk about trance. We encourage our clients into trance.
Mm.
Trance is a very normal thing. We go in and out of trance lots of times during the day. It's just, I mean, it's like daydreaming, being away with the fairies, being in the zone, just a kind of relaxation of the brain, really. So an example I like to use is for somebody who drives. If you're driving down the motorway and you get to junction 19 and you think, I don't remember 17 and 18. So they've not been asleep. If they had, if somebody had pulled out in front of them, they would have put the brakes on and reacted
Exactly.
appropriately.
Or they had to do an emergency stop, for instance.
Yeah, they would be out of it and back, back in the room, back in
Just
the
for
car.
anybody in case they thought they're going to have an accident or something.
Yeah, yeah,
Have
yeah,
to say that they are
yeah.
safe still.
It's just the brain kind of just goes off and does its own thing, and in that state of trance, our brain will go looking for solutions to problems. It will come up with new ideas. It will problem solve, and come to our aid. Our brain does try and help us as much as possible. If you think, I don't know, I've had this situation where I've sort of been in the shower and suddenly thinking, oh yeah, I could do that. That answer comes to you while you're in the shower. And I also wonder whether I've actually applied my conditioner or not, but and sometimes wonder whether I've rinsed it off properly. But yeah, it's perfectly natural, perfectly normal. But of course, we can use that because it in a way brings the two parts of the brain together to work on the problem, the conscious mind and the subconscious mind, and that's how we can find it useful.
It's
So
great.
we set our clients up with a sort of a little picture of how things might be if they were a little feeling a little better, if life was a little bit um, better for them, the problem wasn't quite so obvious. So we set them up with that little picture in our questioning, and then they go into trance, and that gives the opportunity to brain to have a look at that. And they might do that, they might make that change, or they might do something else. But generally we see progress week on week.
So that's what is hypnotherapy really, isn't it? What's involved? Some people may be confused what hypnotherapy is, clinical hypnotherapy, what stage hypnosis, why do
Right.
we have all these different things?
Yeah, it's a question that still comes up. There is still that confusion, not as much as there was when I first qualified.
Mm.
People are starting to see the benefits and talk more about hypnotherapy in a clinical way. So I consider clinical hypnotherapy to mean we are helping people with a medical condition. So it might be anxiety, it might be depression, it might be obsessive compulsive disorder. They might have anger issues. So we're helping clients to get better, I suppose, in with those conditions.
Yeah.
Stage hypnosis is, it's entertainment. It's doing anything for a laugh. But what the stage hypnotist will do is he will very carefully check and select the people he encourages up on the stage. So he will usually do a little bit of a susceptibility test, suggestibility test, like encouraging people to they get their hands stuck together. They're not really, or their feet stuck to the floor. And if people are not doing it, obviously you won't choose them. If people are doing it and appear to be suggestible, and then look like, yeah, pick me, obviously he's going to pick those people.
And I have experience of that.
Oh, really?
That was actually my first experience when I was a student at Manchester. It was
Ah.
one of the evenings out, and we had a hypnotist. I can't remember who it was. I mean, I'd love to know now if it was Paul McKenna or someone, because it was in
Mm,
the 90s, so it could have been doing a
mm,
syndicate. And I remember I volunteered to go up on stage, and it felt like it had maybe a couple of drinks. I wasn't
yeah,
wasn't drunk, but I just
yeah,
felt that the inhibitions had lowered.
yeah, exactly.
That's how it
Yeah.
felt to me, and I wasn't
Mm.
looking to do anything particularly crazy, like quack like a duck or anything like that. Like everyone says, "You're gonna make me cluck like a chicken," don't they?
Mm,
When they
mm.
ask about what we do. But yes, I just had to pretend I was holding onto a balloon, and I felt really floaty, and that was it.
Yeah,
And it was really
yeah.
nice. It was a really pleasant experience. And since then, as I've learned more about hypnotherapy, it's I can equate that. I can relate to clients and how they might be feeling. But
Mm.
isn't it such a gift to be able to help people from medical conditions?
Oh, absolutely. And so many people sort of go to the doctor, they say they've got anxiety. Doctors haven't got the time. They've got, what, 7 minutes per patient. So it's the easiest thing in the world to give them a prescription and send them away. And I'm not dissing the general practice in any shape or
No,
form, because I know they're under such pressure. But to be able to give the client time, to think about how things might be if they were better. What would life be like without the problem? And start giving them hope and forward thinking. Um, and a lot of people don't want to take those
they don't
medications.
now, do they? People are understanding this more
No.
and more. They don't. I
Mm.
mean, okay, people do like a quick fix, but on the other hand, they're more and more aware of the side effects that are,
Yeah.
involved, and it becomes just a cascade of taking medication. As a dentist, I see this with my patients because I have to take naturally everyone's medical history, and okay, they've got this condition. It's going to be this, this, and this they're going to be taking, and it's a given kind of thing. And
Mm.
this is something I want to promote more now because I feel
Mm.
that people just need another option, don't they? They just need their minds opened a little bit and
Yeah,
yeah,
they need to know that they have those strengths and resources
yeah,
to make the change themselves. They don't believe they have. They go to the doctor because they don't have the answers. They come to us as a last resort. How many times have I
so
had a
true.
client say to me, "I've tried everything else. You're my last resort." shouldn't be like that. You
No.
know, it should be
And
obvious that that is an option.
by that time, they've not only lost money, for instance, if you have to pay for their medication, they may be exempt, but there's a cost.
Mm,
Then there's the time factor. How many years have they been suffering and lost
mm,
to being restricted in so many ways? And
mm.
what they do is transformative, isn't it, in their life?
Yeah, and ruined relationships along the way, and
Yeah, yeah,
sadly, yeah. Yeah, so yes, it is brilliant what we do, and really fulfilling to
yeah.
see the change in people, the change in clients.
I wanted to
Mm.
just mention as well, because it's such a responsibility also as being a gift to be able to do this, and everybody who does this is a professional. I
Mm,
just want
absolutely.
I wanted to just draw attention to that side a little bit, how we're regulated, because it's not
Mm,
a regulated profession
we're
actually.
not regulated.
It's not regulated, but yeah.
Yeah, I
Well,
think the closest we have to a regulating body is that there's a government body called the Complementary and Natural Healthcare Council. So anybody who is looking for complementary therapy of any kind should really see somebody who is registered with the CNHC. It is, as I say, it is a government body, and the NHS recommend that if you are going to go to a complementary therapist, that it is somebody registered with the CNHC. And in order to be registered with the CNHC, you have to also belong to some other sort of other bodies, like and we have the National Council for Hypnotherapy and the Association for Solution Focused Hypnotherapy, and both of those have their own guidelines, ethics, and or what's the word I'm looking for? Rush me.
it's a code of conduct.
Code of conduct. Thank you. Yeah, they both have their codes of ethics and conduct, and we need to abide by them. A part of our training is to introduce the students to these bodies and encourage them to join, um, so that we do look professional and we do look like we take these things seriously. Our training course is long and involved and includes a lot of practical work. You start working with people from the very first weekend. That's just doing the relaxation part. But by the time our students graduate after 10 months, they have seen a number of clients. So they go away with experience and confidence from month 10,
Yeah.
and they have their practice in place at
And
month
it helps,
10.
doesn't it, doing the additional diploma? Because, like you, I did the hypnotherapy and practice diploma.
Yeah,
I think
yeah.
that gives a good grounding in the psychotherapy aspect as well, doesn't it? Well, the beginnings of,
Yeah, well, it's a continuing
yes.
learning process, isn't it? But
Mm.
yes, I mean, finishing the course and achieving certain key learning points does give you the diploma in solution focused hypnotherapy. But then there is the hypnotherapy in practice diploma, which is an additional portfolio of work. Yeah, and that's the gold standard. That's a level 4. That's a gold standard qualification for hypnotherapy in this country. And not everybody does it. I admit not everybody completes that diploma, but the majority do. And it's interesting. It's fascinating. If you're interested in this, and we all are, else we wouldn't be doing it.
Yes.
To learning more about the background to these things is important and
I was,
interesting.
I was going to say it's mesmerizing.
Oh, there you go. There you go.
Yeah, well, we both have to mention, don't we, a little bit about the background as well. I've gone a bit back to front here. But we're both from Manchester, and we can't not mention James Braid, can we?
No, of course not. Yeah, he was the first person to use the term hypnosis, in about the 19th century Scottish physician surgeon who used.
180 years ago it was last year.
Oh, really? Oh, did he have a right? Okay,
Yeah,
he had a.
I was so proud of this. That's why, well, I'll mention it in my next video about what I wanted to do, what I have been doing to commemorate that in my life.
Ah, right. Yeah, it's people describe him as the father of hypnosis because he took it very seriously and used it, as for anesthesia and other things. And around that time, people thought it was a satanic device, that it was the work of the devil, and he was able to sort of make it a bit more scientific and bring it further forward. So yeah, we owe him that, definitely.
Oh, Jane, it's been an absolute pleasure speaking with you today.
Oh gosh, have we finished?
Well, I know you've got to dash off. I could just keep you
I
all
yeah,
day. I
I
really
have
could.
got I have got something else in my diary, but
Yeah, I mean, we'll just finish off with one last thing. What would you
yeah.
say are your favorite things about what you do? Yeah.
Oh, I enjoy the education part of it because I sort of see it that not only am I seeing my own clients and helping them, I'm educating other people to do the same. So I kind of see that filtering out into the population. So I enjoy educating, but the main thing is when clients come to you and say, I'm, I've got myself back,
Yeah.
and they're doing things, sometimes after years and years of not being able to do things, and they'll
Yeah.
say, "I wish I'd found you years ago." Just seeing people's lives improve, their relationships improve, maybe getting back into work if they've had a period of time where they've, been off sick. It's a lot of stress and out there in, as you know, there is in dentistry, there is in medicine, there is in teaching. Um, so, a lot of people not coping very well, and we can help them to cope.
So true. And now we're helping to bring the stigma down as well, bring down the barriers of mental health, aren't we? And since COVID,
Yeah,
I think that's helped quite a lot, really, hasn't it? People are more open to the discussion.
yeah, yeah, and they will talk to other people about it more, and they'll say, they will refer more now because they're not embarrassed about the fact that they asked for help or they went to somebody for help. Not only somebody, they went to a hypnotherapist. Wow.
Yeah. And we congratulate them for taking that step, don't we?
Yeah, absolutely.
They're brave in
Absolutely.
doing it and yeah,
Mm.
courageous. And yeah, we're here to help, aren't we? So thank you so much. And
Oh, my
I hope this will
pleasure.
be the first of maybe a series of conversations.
Well, happy to chat always.
Thank you. Well, yeah, thank you for your time today. I
It's a
shall
pleasure.
let you go. Right, bye.
Bye.